What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
You are one pathetic loser.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt and act on anything you hear on this show without talking over with your healthcare provider. Very good. All right, I'm working on a new affiliate agreement. Hopefully, by the time this airs, we will have that in place. Cool. You know what I'm thinking about? Since Amazon hosed us so bad? Walmart.
Walmart sounds good.
You know, Walmart Plus is
yeah.
amazing.
Yeah.
I have resisted that for years, and I needed just a card reader for my studio out there, so I don't have to go running up and down the stairs to to look at my videos and stuff. And I'll be danged if, they had it at Walmart. And I just said, hey, bring it to me. And, a couple hours later, it was sitting on my doorstep.
Wow.
That beats the crap out of Amazon because their distribution center is local if they have what you're looking for.
Yeah.
Then I went walking through Walmart the other day, and they've got way better stuff than they used to have. So, gosh.
I've not been in there, yeah.
I still, listen, if I go to the hardware store, I'm going to Ace Hardware, the locally owned hardware store. I do all that. I shop at the locally owned grocery chain.
But they don't have everything, though.
Yeah,
Walmart,
yeah.
Maybe we need to change.
There's a place for both.
Oh, heck yeah.
But I think for the affiliate agreement, that might be the place to go. So I'm going to look at that.
Cool.
All right. But in the meantime, check out roadie.drsteve.com if you've got a friend or a family member, or if you yourself want to learn to play an instrument. The Roadie Coach is unbelievably inexpensive. It clips onto your guitar. It will listen to you. It will judge you gently, not very harshly, but it will judge you, and it will teach you how to play. And we've had 2 of them, and both the people that I gave them to come in and demonstrate have both moved out of town. So anyway, we'll work on somebody else on that one. But check that out, Roadie, ROADIE.drsteve.com. Check out Dr. Scott's website at simplyherbals.net. You already heard the ad at the beginning of the show. Patreon.com/weirdmedicine, doing some interesting things there now. We'll talk about some of those in a little bit, but we've got the behind the scenes Weird Medicine podcast stuff where we play music or do the podcast, do this part, is all on Patreon. And then on YouTube, they just kind of get the guts of the main show, and without all the extra stuff. And then all of the normal world stuff is going there first. And what the plan is, I'm putting things on Patreon. If it's going to end up in the public's hands eventually, it goes Patreon, then YouTube member, because the tier on the YouTube member is less expensive, okay. and then to the public, and it goes kind of in a week cycle. So, all right, 1 week Patreon, 1 week YouTube member and Patreon, and then 1 week after that to the public. So check it out, patreon.com/weirdmedicine. Tacie and I might start doing shows again.
Maybe.
We just kind of got out of the habit of it.
Did.
But it would be very easy for us to get back in the habit of it again. And then still love to say fluid to your mama. Check out cameo.com/weirdmedicine or shoutout1.com/weirdmedicine. I haven't really been getting many of those because they don't have an app. It's like, how can you do this without an app? But give that a try. Shoutout1.com/weirdmedicine. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And I'm headed to Dallas for the eclipse. Everyone's going to hear this afterward, except for the people that are listening to us live in the Fluid family. By the way, if you want to watch us do this live, and why would you? But, they have fun in the chat room talking amongst themselves. Just go to youtube.com/@weirdmedicine, and you can join and turn on gifted memberships, and people will give away memberships and all kinds of, crazy stuff. So it's wild. So, but anyway, I'm on my way to Dallas to do Normal World.
Okay.
And with Dave Landau, and we've been planning this for months. And of course, it's going to be nothing but clouds. So I'll have a report next week on how it went. But I told them we better have, all these people. It's going right through Dallas, so they were going to have a bunch of people in the park. Traffic is going to be insane.
It's terrible there anyway.
Correct.
I'm in Dallas, Texas. Traffic is
when
awful.
Tacie and I went to my brother's house for the last eclipse, of course, the clouds, we're in the Smoky Mountains.
Sure.
And as the sun is occluded, the temperature drops. Well, what happens in the Smoky Mountains when the temperature drops is they become what their name is. They become their namesake. Clouds start to set in. And precipitation in the air, creating fog, which up high is, we call it a cloud, and it covered up the whole effing thing.
Oh.
So we saw the amplitude of the light go down like someone was turning a dimmer. It was kind of cool.
Wow.
And then there was sort of a eerie blue glow coming from the clouds in the vague direction of the sun. And we were on top of a mountain, so we could see the edge of the shadow, which was pretty cool. And then it came back up. And then as soon as the sun came back, the clouds went away. And, we saw the partial eclipse. That was cool. Well, so been planning this. I said, okay, we're going to my sister's house because it's going to go right over her house. Well, she moved to Florida in the meantime. So, this business with Normal World came up, and, they flew me out there 6 months ago. So, it was time, and it just kind of worked out. So they're flying me out. I'm going to be their correspondent. I spent $300 shipping my telescope, my solar telescope, and all this stuff. Well, I got reimbursed. Tacie's rolling around. I got reimbursed for it, but it was, it's still expensive. And then I just got the forecast that it's going to be cloudy. So I think it's me.
I was going to say, just wherever you're going, go the opposite way.
Now I'm mad.
Yes. Just don't go where Dr. Steve goes.
Well, now I'm mad.
Yeah. Why don't you drop some cash and get on that Delta flight that's
what we're going to do. That's what we're going to do for the next one.
Following the...
yes.
When's the next one?
Well,
20 years.
Well, no, okay, right. That's stupid, right, Tace? Because I won't be here.
He'll be 114.
But no, there's one every 18 months. There's a good one.
Okay,
approximately. It's this thing called the Saros cycle.
Okay,
and so we just need to plan for it. And they do cruises. I think one of the ones is in the Pacific, somewhere off of the coast of Mexico.
That's an even worse idea.
No. No, because
the only way I'll get them on a boat.
That is not true. I've been we don't need to have this conversation. I'm the one who's been agitating for going on a cruise for a long time. But we'll do it because the cruise ship captain can steer the ship away from clouds, and they can put themselves in position where you can see the damn thing. And if that doesn't work, by God, we'll get on an airplane and watch. But I'm not going to die now not seeing a total eclipse of the sun after this.
Mm-hmm.
So, but anyway, I told them we need to have a plan B. We were going to shoot everything from Mercury Studios because we'd have control of the area. We could clear people out so I could have plenty of room for the telescope to see the sun and all that kind of stuff without having to deal with crowds. When Tacie and I went to the last one, it normally takes an hour to go from Franklin, North Carolina to Asheville. My brother lives in Highlands, North Carolina. Normally takes an hour. Took 7 hours just to go that 1 hour stretch, and then we still had 90 minutes to go to get home.
To sit and watch the clouds.
Yeah.
Ugh.
Well,
yucky.
Now, if you look at the eclipse tracks, hey, Tace, this is pretty interesting. There is one place where the two eclipse tracks cross, the ones from last time and this time. And I'm not sure it is somewhere in the middle of the country. I didn't pinpoint it, but I will before I go to Dallas, just so I can, call them Lucky Pierre. I mean, they're going to see it twice without having to leave their homes, which is pretty cool.
Yeah.
But, traffic's going to be an MF. I'm going to try to get to the studio at 9 for a 1:40 eclipse. And just hope for the best. Maybe we'll see a little bit of something. But anyway. So, yeah, that's where we are on that. It doesn't matter now because it's over for everybody but the people who actually are watching this live. There is an eclipse safety video that I did for Normal World. And we were up till 1 o'clock in the morning trying to get that together because somehow it slipped through the cracks and didn't get produced. So a bunch of 3 amateurs tried to put the thing together, which I had learned a lot. And I think that from what I learned about doing green screens and putting stuff up in DaVinci Resolve Studio, which is the software that I have, I think we could start doing our own videos here. I don't have to send them to somebody else to have them put them together.
Right on.
So I think we should do that. We need to sit down. We could do a whole series of Dr. Scott talking about different supplements and stuff. Those could be more serious, and I'll do the ones about dick cheese and toe jam and stuff. All right?
Sounds like a
plan. So I learned a lot doing that. But anyway, that's
cool.
That's kind of the news of the day. So I want to do this call first because we've got some things to talk about, this particular call, and then Tacie's got Tacie time, and then we've got a bunch of calls to take.
Number one thing, don't take advice from some asshole on the radio.
Now, that was just only in one
Yeah,
ear.
that was a mono, wasn't
weird.
it? That was weird.
Okay, let's try that again. Okay, Ronnie B.
Number one thing.
There we go.
Don't take advice from some asshole on the radio.
Yep, old.
I was afraid it was just me. No, I didn't want to say anything. I thought, oh, damn. I've done something to my headset.
The old audio engineer
Steve's going to kill me.
strikes again. All right, here we go. So this guy called in, and he's got a issue that's...
CQ, Dr. Steve. You asked me to call in and share
Okay, so that was ham radio lingo. Never
a
mind.
story that I sent you in an email in the interest of keeping this as short as possible.
Thank you.
I'll just read the email and let you run with its implications.
Okay.
On night shift, the custodian saw me drinking 5-hour energy drinks more than once over time. This guy was a short butterball Hispanic. He asked me if the drinks worked. I looked him over and said, yeah, but I don't recommend them for you unless you do what I did. I then proceeded to tell him to get a calcium score and why. And I hate it when people don't listen to me. 3 months later, he dies of a heart attack.
Yeah.
Yes, he was using the energy drinks to kick himself in the proverbial butt. By the way, I too use modafinil. It makes me feel normal rather than jazzed. Helps me not die when driving. I have hypothyroidism, and like Tacie, I want to choke doctors who say, your numbers are fine,
Yeah.
you are fine.
Yeah.
Well, take the story and run with it.
Thanks, buddy. Yeah, a couple of things on that. Let's hit the Tacie thing. When you tell a patient they're fine and they don't feel fine, then your patients think you're stupid.
Mm-hmm.
Period.
Yep.
Or that you don't care.
Yeah.
Or you're just, a piece of shit or whatever.
Yeah,
So-
asshole.
And it's the same thing with low normal testosterone. Oh, well, your numbers are normal. Well, I don't feel okay. We got to remember that there are people that are at the lower end of the bell curve that are symptomatic and still need treatment. So, quit just blowing people off and sending them off without at least recognizing their illness if they have one. But anyway, so to the first part, this resonates on several levels. Number one, GVAC had a widowmaker myocardial infarction. That's where the main artery that separates from the left anterior descending artery of the heart, which is the main one, and the circumflex, that comes off of one branch, and there's blockage there. Then you have the right coronary artery, and you can have blockage there as well. But on his was right, it cut off two of his three arteries. He was right at the point at 50 where we were going to start doing things like calcium scores and making him go get a colonoscopy and videotaping it and all that stuff, and we were going to yuck it up.
Yeah.
And in retrospect, I really wish that we had gotten that done a little bit sooner. He might still be here today. So the calcium score is scored 0 to 200 is, fine. And then 200 to, I think, 600. Oh, gosh, I can't remember the scoring now. I should know because it affects me. Is moderately high risk, and then greater than 600 is high risk for coronary artery disease. So I just had mine. Mine, when I first did it, probably 12 years ago, was 0. And then I did it 5 years ago, and it was 275. And I just did mine, and I haven't gotten the official result, but it was about 650. So your old buddy is probably going to have to get a cardiac cath. And this is a problem because, Dr. Scott convinced me to stop taking my statin.
Yeah.
No, you weren't wrong. It was affecting me adversely, and I can't take my blood pressure medicine because it was killing me. So I'm in a little bit of a pickle.
Yep.
So there is this new stuff that's a triglyceride medication that actually reduces heart attack and stroke in people, because that's all we care about.
Sure.
Right?
Yep.
The one problem with Zetia is it's an alternative to statins, and it has fewer side effects, but it doesn't reduce heart attack and stroke
Gotcha.
The way that statins do. And that's what we really care about. I don't care what my LDL is.
No.
what I care about is
feeling good.
Well, yeah, not dying.
Yeah.
So there is this thing that is an omega-3 fatty acid. I'm looking for the name of it right now. Damn it, I should have had this up already. But anyway, it's derived from fish oil, is my understanding, and it is prescription only. And it is, I don't have high triglycerides, but it doesn't matter because it reduces heart attack and stroke in people who don't have high triglycerides.
Okay.
So I'm getting on that shit.
Okay.
I'm taking beetroot for my blood pressure.
Mm-hmm.
And I don't know what the mechanism is. Hopefully it's not the same as an angiotensin receptor blocker because that happens sometimes. Red yeast rice brings people's cholesterol down. You know why? Because it has a statin in it, a natural statin.
Mm-hmm.
So you have to be careful with some of these things. Supplements are medicines too. You got to report all of them. Yep. I've got I'm almost as bad as Ray Kurzweil. I've got this list of supplements, but they all are there for a reason.
Sure,
I'm not just taking shit for no reason. But the beetroot actually seems to be helping. My blood pressure was nice and low this morning, and it's been creeping back up.
Are you taking it in pill form, powder, or liquid, or?
Yeah, well, I'm taking it gummies until my powder comes. I bought a
Gotcha.
capsulator, so I'm just going to make my own supplements. And but anyway, so but I'm doing this under the supervision of my primary, and who is a healthy aging, a geriatrician. God, how did this happen?
How did it happen?
I don't know, man.
Anyway,
it seems to go so quickly.
But it just it happened. So I may have to get a cath. We'll see, and I'll keep you in the loop on that. And I'll see if they'll let me videotape that. That is cool.
Yeah, that is cool the way they do it.
So if they'll let us do that, maybe I'll have you come and we'll bring the fancy video camera and we'll just put something together.
That'd be nice. We know the people in the cath lab.
Yeah, we do. Yeah. Hell yeah, we do.
Yep.
So
sounds cool.
Yep. Well, one of them teaches me Bengali phrases. So I'll have him do it. Or the one that we used to play music with.
Yep.
Yeah.
Yep.
Anyway, so that's my news. All right. So the calcium score, yes, get that, please. If you're over 50 and you have one risk factor, high blood pressure, family history, diabetes, high cholesterol, smoking, all of those will qualify you. And your insurance won't pay for it, but it's $50. It's $50 for me.
Wow.
And they have it all worked out. So you go into your My Chart and it goes, the estimated cost is $49. Do you want to pay? And you go, sure. And then you just pay it right there and you never have to worry about it again. So anyway, there's a couple of good things about the computer era. Anyway, all right. Questions, comments? Thank you.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello.
Hello.
So I have two very short little topics today.
All right. We'll make them long and boring.
Yes.
Okay.
Scott
One
and I
of
will.
them is the recipient of world's first pig kidney transplant has been discharged from Boston Hospital.
That's effing amazing.
I heard that. That's cool.
2 weeks after the surgery, they discharged him. He's 62, and he's going to finish his recovery at home.
Wow. So he had a pig heart transplant.
Pig kidney.
Pig kidney.
Yeah.
Oh, okay. Because there is a
genetically
pig to
kidney.
heart.
Yeah, but it's a genetically modified kidney, I would assume.
Okay.
Is that right, Trey? Is that right, Tace? It was that genetically modified kidney, I think.
Basically read the whole article. It was just that.
Okay.
It was like just a snippet, so I don't know the specifics on it.
Okay. Wow.
Yeah, because they did the genetically modified kidney, but used it in a person that was brain dead.
Yes.
Okay.
On a ventilator,
Yes.
and kept him alive and seemed to do it pretty well.
First living recipient of a genetically edited kidney transplant. So what they're doing is they're Do you know about this? Is it genetically edited to turn off the HLA markers so that the person won't reject it?
That's my understanding.
So do they have to take rejection drugs? Surely to God they do.
Would
They
think
still
so.
got a pig kidney in there.
So, yeah. Unless they're able to take the person's stem cells.
I don't see.
I don't think
about
but I would assume they still have to take the anti-rejection medicines.
Okay, so
would think. I would have done
wow.
that. Yeah.
Okay. So, what we've been trying to do for years is put these donor services out of business. They provide a very important and vital service, and they do it very well. But they raise some hackles some places because they can be very aggressive and with their pitch. And very often, some of them are not ours. Ours is pretty good, although they used to be this way. They don't want you to mention that they're coming. So you just delay while you're waiting for them to just show up. And it's like, no, this is my patient. I'm perfectly capable of telling them that you're coming and why you're coming and why we're delaying. Because otherwise, we're just lying to them. Right. I can't lie to somebody. So anyway, but we've been trying to put them out of business for some time, and they're, to be perfectly honest, they're trying to put themselves out of business too, because the whole donation thing is problematic. You have to wait till someone's brain dead, or if you have someone that's going to die and they're going to die within the next hour, you can take them back to the operating room and allow them to pass away in the operating room, and then they get pronounced, and then they open them up and harvest the organs. But you have to be on life support to be able to harvest whole solid organs. You can get skin and corneas off of someone who just died, but if you want, and there aren't that many of those.
No,
right? And it's always a tragedy. But so I'm looking here. The kidney used in the new surgery was modified using gene editing technology, CRISPR, which we've talked about before, to remove certain pig genes that produce sugars with antibodies our immune systems react to. So, and then they added certain human genes to improve the kidney's compatibility with humans. So that is amazing.
That's pretty wild.
Amazing. Okay, well done.
Yeah.
And that was at Mass General Hospital, of course. Yeah. I went there once.
Did you?
Just one time. Yeah, when I was living in Vermont, one of the doctors there, the gastroenterologist, was selling a Mac computer. And he was a ham radio operator, and I bought it off of a ham radio bulletin board that I accessed. Well, we didn't have internet, so I had to access it through the ham radio packet radio system. Yeah, it was crazy.
That's so funny.
Yep, I met him right at the door, and he gave it to me. I turned around and drove home.
Thanks a lot.
But it was pretty cool. It was an amazing place. You could just tell it was buzzing with academic knowledge.
What's going to be interesting is to see if they can, how many of these pig kidneys they can do gene editing on, and how quickly.
You just start making them.
Yeah, that's
and
what
then
I was gonna
I'm
say.
assuming that they're still tasty, so they can.
Goodness.
Well. I'm just saying they wouldn't just harvest the kidneys and then throw the rest of the poor pig away.
Well, I guess I was just wondering if they can actually do it without having an actual inside of a pig.
Oh, yes.
Like, did it do it in
that's the eventual goal is to 3D print organs.
Right.
Now, you can 3D print scaffolding now, and then you got to get
ears. Well, to be clear, like for ears and noses that are mostly cartilage, you can 3D print those things.
Well, there was a guy that got in trouble. You watched that show, didn't you, Tace, where he was 3D printing, I think, tracheas.
We saw that.
And then seeding them with human tissue and saying, it'll grow.
Yeah.
And it
didn't turn out so well.
No. So I don't know if he was 3D printing or using cadaver cartilage, but anyway.
That's Dr. Death.
I want to say cadaver.
Could have been.
And then putting, the person.
I can't remember.
And then was injecting with the person's like stem cells or something.
Right, and saying, it will grow. And then, it didn't turn out. I had, I've seen a couple of patients that had 3D printed jawbones. You know, like if they had head and neck cancer and they had to remove the bone, and they just 3D print it and slap it in there.
Well, you got to figure they probably are doing
amazing.
And I don't know this for sure, but I would assume that, like the neurosurgeons that do cranies, or if they have to replace a part of the scalp, that's kind of what they do.
Yeah, I've seen that.
Yeah, yep.
Keep talking for a second.
So,
I'm looking up for rejection.
Yeah, but you know what I think is going to be next? A lot of this 3D printing technology is going to be used for total knees and total hips to make those surgeries a lot less painful and to allow people to heal much more quickly.
Yeah.
And they're already pretty close.
Yeah, I'm looking at the actual story that was published in Scientific Bulletins. Oh, okay. This was September of 2023. This is actually a Chinese research group, and so this gene editing changes. It makes the pig kidney more acceptable to the body, but there's still some risk of rejection. So it says conventional immunosuppressive therapy has not proven fully effective in preventing the immune response to pig xenograft. Okay, that was before. And so with this new thing, apparently it is successful. So looks, according to this, and I don't know about the Mass General, but if you'll write it down, I'll find out for next week. Okay. It looks like they're still having to give them anti-rejection drugs. That would be too good to be true.
Yeah, it would be, for sure.
But I see eventually this will be happening, and 3D printing of organs would be an amazing advance. And then the only thing that's after that is just, what is the thing that Star Trek uses? What do they call that thing that, just makes whatever they want? Like, Earl Grey. What is that thing? Not the transporter. What's wrong with me?
It's not the simulator, is it?
No. Shit. Well, anyway. That would be the next thing.
Don't look at me.
Yeah. I'm looking at you. I'm not looking for answers.
You knew better than that.
Anyway, that's a good one, Tacie. So we'll find out more about that. I should have read up on it before we started yapping about it. But anyway, it's a good one.
Good one, Tacie.
Congratulations to Mass General, and more importantly, this patient who's walking around with a dang pig.
Who's giving it a go.
Yep. Now, if you are adverse to pork, then would you turn this thing down if it was offered to you?
You mean like if you're a vegan?
Or, listen, vegans should be okay with transplants because they're made of meat. They just don't eat meat.
Maybe.
But I'm thinking if you had a religious, reason for being adverse to pork, because, there are groups that are adverse to blood transfusion and stuff like that. So I just wonder what the position is. As technology changes, you have to start making a decision about some of these things.
I wonder why they, just out of curiosity, I don't know if you'll know this or something, but I wonder why they use the pig kidneys because they're pretty similar to the human kidney.
Yeah.
But why not like an ape kidney or gorilla?
Well, can you imagine a lab where they've got a bunch of chimps and they're just harvesting their organs, the nightmare public relations that would be.
You're probably right, yeah.
So people are used to us using pigs for stuff. I really think that's got a lot to do with it.
You might be right, yeah.
But anyway.
Interesting.
All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish. or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Sergeant and Mr. Smith, you're gonna love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
Hello? Hey, Mom, what dog food do you feed Daisy?
Daisy gets Blue Buffalo, life protection formula.
I see IAMS. Can I just grab that?
Well, what are the ingredients?
Let's see. It's chicken, ground whole grain corn, ground whole grain sorghum, chicken byproduct meal.
What about Blue?
Chicken meal, brown rice, oatmeal, barley. Okay, I'll grab Blue Buffalo. Thanks, Mom.
Switch to Blue Life Protection Formula and feed your dog like family.
Hi, I'm Lara. After 20 years of Larabar, I still believe that simple and real can be delicious, which is why we're introducing Trail Mix Bars, a new crunchy, chewy Larabar made with regenerative almonds. Follow our almond journey at larabar.com.
Okay.
Thank you,
Topic
Tacie.
number 2. Viagra may help reduce Alzheimer's risk, study suggests.
Yay.
Sildenafil, a compound in drugs that treat erectile dysfunction and one type of hypertension, could be used to prevent and treat Alzheimer's disease, the results of a new study suggests.
Wow.
Among people who already take sildenafil, the main ingredient in Viagra, the incidence of Alzheimer's disease was significantly less than people who did not.
What? How often do they have to take it?
It doesn't say. At least one expert warned that an observational study such as this may not be telling the whole story and should be approached with caution.
Right. So this is just a signal that now requires a double-blind placebo-controlled studies.
Researchers
but it was
led by
a huge number. It's 30 to 54% reduction.
Yes, that's what I was getting ready to say.
Yeah, I'm sorry.
So,
and these are among people, okay, we're taking sildenafil for erectile dysfunction or pulmonary arterial hypertension. Those people take it 3 times a day. You know, they'll take a low dose of sildenafil 2 to 3 times a day, whereas the people that just want to beat their meat or have intercourse may take it once or twice a week. So may not be dose dependent. God, I need to get back on that stuff.
Sounds good.
It works by lowering tau.
Can we buy it by the bucket?
Yeah, well, it's generic now. You can get it pretty cheap. Yeah, isn't that interesting? Wow.
Yeah, that's pretty cool.
The authors of the new study utilized computational models to parse the data for millions of patients in 2 medical databases. The reduction in Alzheimer's was 54%. So what they did was they just took a giant database and just mined it for interesting findings. And those are fine as long as you realize what they are.
Okay.
Now you have to do a prospective, meaning going forward in time. It's got a beginning, a middle, and an end.
and include women.
And yes, that's right.
True. Good point.
That is absolutely right. Because men and women, amazingly, do have some differences when it comes to the way that they react to medication and stuff.
Yeah.
So, we need to go forward in time with matched cohort with a placebo and follow them over, a 5-year period, and you should have enough data if you have enough people in it to see, and then decode it at the end and see if there's a statistically significant difference. If it is 50% reduction in Alzheimer's in people who are taking that, that's the number one. Pfizer will rebrand this drug, so that they can sell it again, and it will be huge. and we'll all be walking around, not having dementia, and all having big, giant, meaty erections. And blood flow to our nether regions if we're not, if we don't have male genitalia. That's amazing.
That is pretty wild.
Yeah.
That's some good stuff. Hey,
Yeah.
good news. That's good news. We like good news.
Well, they're finding some of these things through machine learning, too, where they'll just they'll say, here's the receptor, find a drug that might affect that receptor.
Right.
And then it just goes through and just starts sifting through all this data. And, very interesting. Okay, good. That
All
it,
right,
Tace?
that's all.
Okay, well.
Give thyself a bell.
Suck it.
Yeah, I was gonna say I've got to agree with that, Bill.
That's a good one.
That's legit. Yeah.
All right.
Well, hello, Dr. Steve. This is Danny there from Edmonton. How you doing?
Hey.
I've got a question for you.
Okay. Okay, never mind. I'm sorry.
Good day, mate.
I'm sorry. No, that's what
What
was
just happened?
I'm
being
doing
stupid.
the
Just being stupid.
The Bob and
no, it's
Tom
not Bob. It's not.
McKenzie.
Oh yeah, Bob and Tom.
No, it's not
McKenzie,
Bob
yeah,
and Tom McKenzie. What the
No,
hell?
it's the brothers.
Yeah, it's the McKenzie brothers.
McKenzie
though,
brothers,
right?
yeah.
Anyway, all right. Whoa, you hoser.
I've got a question for you.
Sorry. Poor guy calls from Canada. And
With
then,
a
of
legitimate
course,
question.
typical, well, your money ain't worth nothing. And
Well, hello, Dr. Steve. This is
you watch the Great White North on SCTV? It's just ridiculous. I'm sorry, man.
Danny there from Edmonton. How you doing?
Danny. Yeah, good, man.
I've got a question for you. My cum, it doesn't taste as nice.
Okay, I'm sorry. I take it all back.
We meant every bit of it.
Everything we just said was correct.
Danny
Agreed.
Dare. Danny Dare. Danny Dare.
It doesn't taste as nice as it used to when I was younger.
Oh,
Oh
okay.
my
Is
goodness.
there a reason for that?
Yes.
It's really starting to bother me.
Yes.
Anyway, I'll hang up and listen. Thanks, Doc.
Okay, I recognize the voice. So that is one of our friends.
A little late, Dr.
From
Steve.
Minnesota. Yes, but anyway.
A little late.
Well, no, it's a good question. Semen does have a taste, and it can be modified. If you are, we've talked about this before, that there is a protein in semen called seminogelin that causes it to coagulate when it is released from the body. And the purpose of that is to keep semen in the female body. We tend to forget what procreation was designed for. And so it's designed to, further the species, obviously, but a seminogelin facilitates semen staying in the vagina and not just blooping out when the woman stands up after having intercourse. So, but if it will coagulate in the seminal vesicles if you leave it in there for long enough. And I'm assuming that old semen doesn't taste very good.
Tastes stale, I would assume.
Right. I think it tastes.
One would assume.
Probably does. We could maybe do a study on this. I don't know, but you will have some change in the taste because of the change in these proteins, and I think fresh. Young
Oh my God.
semen. What? Fresh.
You doing the study on this? I'm thinking
Fresh young
you have
semen.
to find somebody else.
Scorn and defiance.
But
oh my.
Yes, I think that coagulated semen is going to taste different because the proteins are in different orientations and configurations. And if you want to make your semen taste better, what we are told by adult film stars is drink pineapple juice or eat more pineapples. So there is a sugar that tastes good that is actually deposited in the semen. I'd love to do that study. That would be a fun one. It would be really easy to do. You would just have somebody eat lots of pineapple. Okay, seriously. Have you ever listened to this show?
It's certainly the pineapple talk
It's just
is
really hard today.
Okay. Anyway, you would have a group of people that don't eat pineapple, men who can ejaculate into a cup, and then you would have a group of men that do. You would probably only need 5 in each. And I would run their semen. You solubilize it in saline and run it through a GC mass spec. or a thin layer chromatography. And what that does is it'll separate out all of the components of the semen.
Right.
And what you're looking for is a spike in the sugar region of people that are taking pineapple supplements versus people that aren't. So that would be an interesting study. The problem with these kinds of studies is we can conceive of them, but they're hard to get them funded. And the thin layer chromatography and the GC mass spec isn't free.
No.
Now, when I did the thing with Howard Stern for the Germia staffer, I did get our lab to do it for free. And they gave me the swabs, and I sent them up to Mehmet Walker, and he swabbed everybody. And my innovation in that was to swab Richard Christie's ass crack as well as his hands, just to see as a control. And when we got it back, we took them to the lab, and they plated everything, identified all the bacteria that were on there, and they gave me a report. Didn't charge us anything. Wow. And I sent all of that to Mehmet. And the crazy thing was Richard Christie's hands were more disgusting with E. coli than his ass crack was. So anyway, all right. Good old Richard. All right. Let's do this one.
Hi, Dr. Steve. I have a question. I'm wondering why, when you get a total knee replacement, do they want you up and walking like hours after surgery? Like,
Right.
within 2 or 3 hours after surgery, they want you up and walking. I'm sure it has something to do with...
I'm going to say this. It didn't used to be that way. That is a more recent innovation. Yeah. They used to have you in bed, and they had this...
Bender.
This sort of
The
weird
extender, yeah.
track thing that
That was
they'd
awful.
fix your foot in, and it would flex and extend your knee.
blood clots, but there's got to be more to it. But also a reverse shoulder replacement. I'm due for one of those as well, and doctor told me I'm going to have to wear a sling for 6 to 8 weeks, or immobilizer, with very little to no movement of the shoulder at all.
Correct.
What's the difference between the two now?
Yeah, that's a really good question. I'll give my sort of Reader's Digest thing, and then Dr. Scott deals with this stuff every day.
Sure.
So the way I dope this out is the knee's a very simple joint. It goes up and it goes back. It goes up and it's back. It's just a hinge.
Yep.
The shoulder is vastly more complex. It has to rotate in all these different directions, and the rotator cuff itself is extremely complex. I remember trying to memorize that shit. The origins the origins and the insertions of all those stupid muscles in the shoulder, and I assume that's why. Now I know that when they when you break your humerus, they'll use a sling and swab. They just hold it next to your body for 6 weeks. So those two things are probably related. But anyway, Dr. Scott, what do you think?
Yeah, so the total knee, first of all, they used to use big, long metal spikes that they drove down into your tibia. They were long and painful, and that was part of the reason why it took so much effort.
The intramedullary nails, or are you talking about... Oh, when they do the knee replacement,
right? On a total knee, yeah. I'm sorry, yeah.
Right.
So what they would do is they'd cut off part of your upper leg, part of the tibial bone, and then they'd drill down. They'd literally hammer in,
with a big mallet.
A big mallet, and with a big spike and a cap on top of the knee. And it's really traumatic to the knee. It's really traumatic to the entire lower extremity.
Yeah,
and caused a lot of pain. I actually had a guy that had a disease called ankylosing.
Ankylosing spondylitis.
Yeah. And his bones were profoundly hard. The surgeon actually broke his mallet trying to hammer in this spike into his knee, and he had terrible swelling. For like 18 months, he had just awful swelling in his lower, just very traumatic. So the newest total knees is really kind of interesting. They've kind of figured out that the old total knees, they used to do this the cut right on the middle of the knee. You could see it just perfectly, and that was another problem because when you bend and flex your knee, that skin is tight and the scarring can be really painful. What they're doing, or not all of them, but a lot of these guys now are doing a cut towards the medial aspect, so the tension on the inside, right on the inner part of the knee, and they're not having to do this massive spike down the knee. There's actually one surgeon here locally that doesn't even use a spike at all. Now, there's another guy that uses a spike that goes into the top of the tibia that's not even a full inch long.
They do just like little pegs or something?
The one is just little tiny pegs, almost like it's... I can't.
So they have to have a jig to put on the knee and then drill their holes in the right place, so when they put this thing on there, it fits
just
perfectly.
Tiny, and it doesn't...
And then they use cement.
Yep, and then what they do is it's crazy. So there's very little trauma to the knee and very little trauma to the lower extremities. And so what they want you to do is immediately get up and start walking so that thing will seed a little bit, with the load of your weight. And it also helps to increase blood flow and muscle tension. So that's what it's going to do.
A bell for that.
You deserve that bell.
Oh, thank you, Tacie. You're so sweet.
Because the joint serves a different function too.
Yeah, totally different.
The shoulder is there to sort of transport the hand in different places, whereas the knee is there to support weight and then allow you to transport the whole body.
Yeah, and the shoulder's a whole different animal. I mean, you just think about the little nerves and little vascular bundles that go through there. I mean, it's a really, really difficult joint. And what we see is the shoulders for us are really the hardest things that we treat. Post-surgically, as far as pain-wise. Golly, and then they kind of figured out that doing a reverse total shoulder, because it used to be a total shoulder, just like a total knee or total hip, where they cut the bone off and they'd put this spike in with a ball in there, and they plop it back up into the shoulder capsule. And those were extremely painful.
So what's the reverse?
So what they're doing now, they actually have the kind of...
Sounds to me like they're taking one out of there.
They actually flip it, so the flat part is like the bone, and they have the ball like up in the shoulder capsule itself. So when it goes up, it's...
Really?
It seems to heal better. Yeah, it seems to heal better. Yeah, it's just a whole different... They literally flip the parts of the anatomy.
Really?
Yeah, it's crazy.
How does that work?
I don't know, but the people I've seen that have it, they do extremely well.
Wow, that's a good
So the pain's less, but the bottom line is, in that instance, there's so much swelling and so much soft tissue. But more importantly, Dr. Stephen, you know as well as I do, the vascular bundles and neurological bundles coming through the armpit. Yeah, and that's why they really keep them immobile for a long time.
Yeah.
And then they start moving.
The knee's just a big stupid joint. The shoulder is a very
pretty challenging
joint. Yeah. Okay, very good. Thank you.
Hey, Dr. Steve, it's Matt in Charleston. How are you?
Hey, Matt. Good.
Oh, good. Yeah, we're good.
Yeah, good.
Hey,
okay, let me try that one again.
Dr. Steve, it's Matt in Charleston. How are you?
Hey, doing good, man. How are you?
Oh, good. Yeah, we're good.
There you go.
Hey, listen, I have a quick question for you via my wife.
Okay.
I'm curious, where does mucus and snot come from?
Okay.
And why do we have it? What is its purpose? How do we make it? Why is there so much?
Yeah.
Obviously, we're dealing with some congestion in our house.
Okay.
Thanks for your help.
Well, I mean, mucus comes from...
It's mucous membrane, bro.
So everything in the human body has to... I mean, we can't transport stuff across air in the human body. So cells have to get from one place to another through fluid... And to allow that to happen, so we have fluid in the interstitial fluid, which is between the cells and in the cells, and then we have extracellular fluid, which is like blood and stuff like that. That's outside of the cells, and all of these things help to transport things from one place to the other. We just really don't have a way to do it otherwise. And mucus serves a lot of different purposes. One is just pure protection. Tacie, you want to talk about mucus in the stomach for a second? You're an expert on that.
No.
No. Okay, fair enough.
I don't care.
So mucous membrane in the stomach has things, contains proteins and prostaglandins and other substances that would protect the stomach from stomach acid so it's not digesting itself. And then the mucus in your mouth keeps... I mean, if you've ever had dry mouth, you notice that your teeth start to go bad, and because they need to be constantly washed with fluid, and, stuff collects in your mouth and all that stuff. So that's why we have saliva. Mm-hmm. Saliva also has enzymes in it that help to pre-digest carbohydrates. Mm-hmm. So if you take bread and you chew it up and just keep chewing it, and you leave it in your mouth, it'll start to turn sweet because it's turning the enzymes in your saliva are turning that bread into sugars. So it's transporting enzymes, but also facilitating swallowing of food and that kind of stuff. Now, in the nose, it's a little bit different. My hypothesis has always been that, sadly, I have to use a teleological explanation, where there's purpose, where no purpose actually exists. But it was sort of designed to get antigens out of your nose. One of the functions of the nose is to trap dust and allergens and pathogens and stuff like that in the vibrissae of the nose. And the mucous membrane will also, stuff sticks to it like flies on flypaper. And then if it is a particularly repugnant antigen, then it will stimulate a histamine response. And when histamine, and here this gets to the second part of his question, where does it come from? Histamine will allow the transport of hyperfiltrated blood, a.k.a. water, basically, with some proteins in it that make it sort of gushy, from the capillaries to the outside world. So the capillaries open up, and this is why you get congestion as well, because when the capillaries open up, the volume of fluid in your nose increases, so that decreases the airway space. And then this ultrafiltrated blood that has no red blood cells in it, and that's why it's clear, is excreted across the membrane, and then it starts flushing stuff out. And this happens in the lungs as well when you have pulmonary congestion. And it can also happen, but this is not really mucus, when people have congestive heart failure, but that is a pressure problem. That's where they, it's like a pipe, not a pipe, a pump that has gotten overprimed, and it backs up, and the pressure is so high in the capillaries of the lungs that that fluid is secreted into the lungs, and it decreases the ability to transport oxygen from the outside to the inside, and you get short of breath, and then it can be a vicious cycle. But that's basically congestive heart failure. But what he's talking about is the response to allergens in the nose causing histamine response and other things. That's why you take an antihistamine. And if you want to get rid of congestion in your nose quickly, you can take Afrin, which is oxymetazoline. Be careful because it is habit-forming. But if you use it, you'll notice it works almost right away because it's a vasoconstrictor. It constricts the capillaries in the nose, and when that happens, it's the opposite. You have decreased volume of fluid in the tissues, and then the airways open up. That stuff's like magic.
You could use it Simply Herbal's nasal spray and wash that shit out, man.
Well, you could, yes.
Literally wash it out.
Absolutely right. Yeah, you can.
That's another option.
You can wash the allergens out, and then you're just. That way, you're doing the body's job for it.
You're helping it. Yeah, you're helping it.
Correct. Yeah. So if you spray that, I've sprayed that stuff up there, let it sit for a minute, and then just blow it back out again. And that very often helps, particularly during periods where I've gotten into pollen or something like that. And then the other thing, and Dr. Scott would rather that you use his product at simplyherbals.net, but I really like the Navage.
I like the Navage too.
The Navage is an electric neti pot where you don't have to look as stupid doing it.
Well,
just Google
I might disagree. I think it's worse. Don't you think?
No.
It looks like you're being attacked by an alien.
Go Google neti pot, Google image neti pot, and all those people look stupid as hell. I know it feels good and it works, but you just look like an idiot. Whereas this thing looks like you've just got a medical device attached to your face. So, well,
I know.
You all decide on your own.
Yes.
Look at it, and whichever one you feel least stupid doing. Now, the neti pot's a lot cheaper, but use distilled water and use saline. Do not use just...
but nasal lavage, I think, is far superior to washing the crud out.
Correct. Correct. Either way, however you do it. But use distilled water. You don't want amoebas and other things, paramecium getting up in your nose. And, amoebic encephalitis can be fatal. It's very hard to kill once they get in there. Be careful with hot springs if they're not hot enough, too. And fresh water, when you dive down and you get that stuff up in your nose, just make sure that you're in an area that's known to be safe with their fresh water, and they've never had any amoebic encephalitis cases.
Right.
I don't swim a whole lot in fresh water anymore. Salt water, no problem. No. Give me a shark any day.
Right on.
Because they're going to leave me alone. Those stupid amoebas. Just, ooh, I said brains taste good. All right. So, let me see. Well, I'll tell you what. We don't have a whole lot of time left, so I'm just going to kill some time. Get your calcium scores done if you're fit. What have we done today? Get your calcium scores done if you're 50 and you have a single risk factor. That'll be anywhere between $50 and $150. Really helps.
Take Viagra if you want to avoid Alzheimer's.
Yeah, it sure looks like it.
Looks like it.
We'll see. Yeah. We'll see. Viagra will stay cheap until they actually prove that this is a real effect, and when they do,
it's going to be very expensive.
We're screwed again. All right, Dr. Scott, before we go, let's hit the fluid family.
Yeah.
I see a couple of, let's see, Chris R., thank you for the $5 super chat.
Well,
where I'm at, it will be sunny and 80% eclipse.
Wow, that is very interesting. Please tell me more.
How stupid.
I don't care. I don't care.
Damn it. Well, listen, Chris, you don't have to travel too far to get to 100% if you're at 80% where you are. It will still be really cool. 80% is still awesome. Get a colander out and just hold it up over a piece of paper, and when it gets to 80%, you'll be able to see a bunch of little crescent suns.
80%
it's pretty neat.
suns,
Yep. Radish gifted 10 Weird Medicine Dr. Steve memberships. Thank you, my friend. Usually Myrtle does that, but she hadn't gotten in there today. I really appreciate Radish on that. And
maybe Myrtle died.
No, she's not. Oh my God! Did I hear my name? I'm still amongst the living. I tell you. So although with this rheumatiz, sometimes.
Okay.
I don't.
Gosh, boy, did I make a mistake on that one.
Well, I was on.
Think before you ask.
I was on Tukey Soup. And I just went, he sent out the link, so I went in as Cletus, right? And he'd never experienced Cletus before, and Cletus will not shut up. Now, number one, he works for Travis Tritt, so that is something. And he's always talking to Travis Tritt about the dabble verse and all that stuff.
How did we miss this, Tace?
Oh, my God. Well,
how did we miss it?
I haven't.
He hated it, which was great. And he's like, this is terrible. Does he ever shut up? Because, Cletus would just go on and on. So I noticed that he knocked me out of the room while I kept talking, and then he brought me back in, and I'm like talking about tornadoes and, well, black by day and white by night, beware tornadoes, say Mama D. White, and all this stupid crap. Oh, no. And I laughed so hard, and he loved it. So I think what we're going to do is, breaking down the fourth wall, as Cletus is going to be on every once in a while. Small doses, all very small doses.
That's what you want to hear, everyone.
Okay, all right. Okay, you know what?
I hope we get.
Lord and Lady, do survive.
I hope we don't miss that.
Yeah.
But anyway,
I hope we don't miss the.
Okay,
the
but the bit is going to be that Cardiff Electric sent Cletus there to ruin his show. That's what it is.
Yeah, it makes perfect sense.
Yeah. All right. Okay. Fuck.
We've got a couple questions.
Okay. Yeah, let's do them.
Hey, so Matthew's got a good question about eustachian tubes.
Oh yeah.
He said that he had goo in his ear that wouldn't go away.
Yeah.
And wouldn't drain for months, and then just suddenly it did. He was just wondering kind of about the anatomy of the eustachian tubes and how did that happen?
Absolutely. So I when I have someone come in with a middle ear infection, I have a drawing that I'll sort of produce every time. I just draw out sort of a schematic of the anatomy. But think of it this way: you've got the ear canal, then you have the eardrum, which is occlusive. I mean, it covers the whole thing. There's no air exchange between the ear canal and the middle ear, and then you have the hammer, anvil, and stirrup that transmit vibrations from the eardrum into the inner ear. But in that middle ear, where those three bones are, is an air-filled cavity. Well, any air-filled cavity in the body has to have a communication with the outside world to equalize the pressure. Well, this thing is way the hell in the body.
Deep,
so where is it going to do it? You don't have a hole coming, a blowhole coming out of the top of your head. So that place that equalizes the pressure is the eustachian tube, and it opens up in the back of your throat, and it is surrounded by the adenoids, which are immune-type tissue. It's like lymphatic tissue. So you've heard of people having an adenoidectomy. That's where they go in and just scrape that tissue out because those people's the tissue around their eustachian tube is so swollen that they can't ever get their ear to equalize.
Yeah.
Now, so when you go up in an airplane, you'll notice that if you yawn, your ears will pop. And that is because as you go up, the air pressure outside is less than the air pressure inside. So now the eardrum will bow outward toward the outside world as the pressure inside the middle ear is increased relative to the pressure outside.
Right.
And then eventually the pressure will build up enough where some air will flow through the eustachian tube into the back of the throat, and then you hear that sort of noise.
Yep.
And then your hearing improves and you can feel that something changed in there. Now, when you're going down, it's just the opposite. The pressure on the outside is greater than the pressure on the inside, and the eardrum will bow inward, okay? And then that's when you're going down, you have to pop your ears by blowing, right? So head forward like you're sniffing roses, occlude your nose, and then blow with your mouth closed, and a lot of times that'll pop your ears. It's called Valsalva maneuver. Now, so that's airplane. Now, what happens if the adenoids are large or the eustachian tube is not draining? What's going to happen to the inner ear or the middle ear? Well, there are capillaries that run through there. And capillaries have this property that they work like little oxygen vacuum pumps. This is how the lungs work, okay? It works the same way in the middle ear. Those capillaries will start to take oxygen molecules out of the middle ear. And they'll do it very slowly. It's a very slow process, but it's inexorable. In other words, over time, you will get a decreased pressure in the middle ear. And if that eustachian tube doesn't open up, now the eardrum is going to bow inward, and you're going to have negative pressure. And if it gets bad enough, the body's got to equalize that pressure somehow. So what will happen is fluid will flow in from those capillaries. As they're taking oxygen out, they will transmit fluid into this low pressure area because it's just basically getting sucked out there. Okay, now you have a middle ear full of fluid.
Yep.
And that is a lot harder to get rid of. And if you pop your ears, which is what you should do in this situation, is try to pop your ears, you may not be able to because now your ear is filled with fluid that's thickening. Now, if you get one bacteria in there that can divide, now you have a middle ear infection. And what happens with severe middle ear infections, Dr. Scott? You get a perforation of the eardrum, which is a way for the body to equalize the pressure. And that's what we do when we put tubes, myringotomy tubes. I was going to say ear holes, myringotomy tubes in kids' ears when they get a bunch of ear infections. It's exactly the same thing. So we learned from nature that if we put those tubes in there, equalize the pressure, then this won't happen.
Well,
and that's what's going on.
Can I?
Yes, absolutely.
And I was going to say another great little trick that you.
I was going to give you a trick for getting rid of this, but go ahead.
Balloon.
Go ahead.
Is that your trick?
No, go ahead.
Yeah, I was going to say sometimes when you do have that pressure inside and you're having trouble getting rid of it,
blow up a balloon.
Take a balloon and blow it up and blow it really hard and do that throughout the day. A lot of times they'll open those eustachian tubes in the back of your throat.
Some people are unable to pop their ears. Yeah. It is a technique. You have to learn how to do it. You have to push the air toward the back of the throat just the right way.
Yeah, it's tough.
What we also tell people to do is you can get those pediatric nose drops, the neosynephrine nose drops. And if you have eustachian tube that's clogged, you lay down and point your nose holes up to the ceiling. Okay. And then, the tip of your nose up toward the ceiling, so your nose holes are going straight back.
Right, okay, gotcha.
Then you will instill this stuff until you feel it kind of pooling in the back of your throat. Now, what it's doing is it's going to start pooling right on the eustachian tube because those adenoids surround it, forms like a little cup, and it'll sit there. And that pediatric neosynephrine will decrease the size of the capillaries in there, therefore increasing the caliber of the eustachian tube, and very often will open it up. And then you just got to pop your ears, and they'll be back to normal again. Okay?
Gotcha.
All right.
Good.
Excellent question.
Good job.
Yeah,
we got one more.
I hope that was interesting and not just stultifyingly anatomic.
No, I thought it was pretty good.
Okay, well,
you
don't matter, though.
That is very true. That is very true. Hey, so Johnny Longfellow's got one. Sequential subconjunctival hemorrhages.
Yeah.
He said 4 in the last 2 months. Any comments?
Oh, okay. Well, you want to talk about what a subconjunctival hemorrhage is?
Sure, you'll get a little bleeding just underneath the clear lining of your eye. It makes you look like you got a blood inside your eye.
And it's bright red.
And it's a really bright red. And it can happen for a number of reasons, especially if it's recurrent. It could be traumatic. I mean, you could be rubbing your eyes really hard. You could have, maybe gotten hit with a baseball. Sometimes you can cough and sneeze so vigorously that you can cause the blood, those little hemorrhages inside, and cause those little bleeds in your eyes. There are a couple.
Straining. Heavy lifting. Beating off and holding your breath, stuff like that. I mean, for real.
Yeah.
But if you have recurrent subconjunctival hemorrhages and you don't have an explanation for it, that's an indication to get a complete blood count, make sure your platelet count's okay.
Right on.
And if you're taking anticoagulants,
so blood thinners, aspirin,
aspirin
will do it. Yeah.
Could do it as well, or any NSAID could do that. Yeah. So we always look at medications first. When we see something weird, could that be the issue? And if it isn't, talk to your primary care. They should do a complete blood count. And if there's anything weird on that, they'll just send you to a hematologist just to make sure that your platelets are functioning properly.
Right.
Because you can have the right number, but they may not be functioning properly.
Oh, no.
So there is there's a bunch of blood tests that you can do. There's a bleeding time test. We do that for people who have bleeding issues but have normal platelet counts, and you basically cut their skin and you use blotting paper to blot the blood away.
Okay.
And then you time how long it takes for it to stop.
Right on.
And there's a range that's normal, and if it's above that, then you may have a platelet issue.
Gotcha.
Did anybody in your family ever have an issue with coagulation? And if all it does is cause a subconjunctival hemorrhage every once in a while, then it's not that big of a deal.
Yeah.
But get it checked out.
Yep.
Let us know.
All right, we'll do her.
All right. Anything else? You got anything else to plug, Dr. Scott?
No, sir. I think we're good.
All right. I'm trying to figure out how the hell to get out of here. Okay, here we go. Sorry. Thanks always go to Dr. Scott, or you'd think I'd be able to do that without reading it. Thank you, Tacie. Thanks, everyone who has made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks,
Bye.
everybody.
See you guys.